The number of patients who have died in English hospitals after testing positive for COVID-19 has now risen to almost 15,000. But there are signs that the rate is continuing to slow. In England, another 429 people are confirmed to have died after testing positive for coronavirus, with the largest number in today's update, 112, in the northwest of England. It takes the total number of confirmed hospital deaths in England to 14,829. There have been 12 more deaths in hospitals in Scotland, taking the total to 915. 9 more hospital deaths in Wales, bringing the total to 584. We're waiting still for an update from Northern Ireland, but as of yesterday, 194 people have died with coronavirus in hospitals there. Our correspondent, Helen-Ann Smith, is in the newsroom. And Helen-Ann, just break down these figures for us.
Well, Mark, the first thing to say is that these figures on Monday are sometimes potentially a touch misleading, because we have to always remember these are not the number of people who sadly died yesterday. They're the number of people that the hospital trusts across the UK reported to have died yesterday. So the numbers are often a little artificially low on Mondays, purely because obviously yesterday, Sunday, probably fewer administrative staff in over the weekend. So that's worth saying. However, just to take the English number as an example, that jump of 429 deaths, that's the lowest daily jump that we've seen for 3 weeks. And you'll remember 3 weeks ago, there was some alarm at the sheer speed at which the numbers were rising. So that's certainly a promising milestone, shall we say. Now, we might be able to show you now a graphic that just shows the cumulative number of deaths, so essentially the total number of deaths and how they've been rising. Because as we've always been saying, just worth saying that this is showing the UK totals, and we are still waiting for today's UK total that gets released by the Department for Health and Social Care. But this is what we knew up until, what we know up until now. You see that scale there. What we're interested in is the speed at which those number of deaths are rising, because the speed shows us something about the way that the disease is spreading, and whether we may be starting to gain some control. You'll notice at the beginning, that death toll doubling every 2 days, then every 3 days. Now it's over here, doubling every 12 days. So as you can see, that's really slowing down. And what we're also interested in is looking at the percentage increase and how much it's growing each day. So for example, between yesterday and the day before here, it's very difficult to tell from with the naked eye, but that's an increase of roughly 4%. If we take that a week ago, just worth saying, not the Mondays, because the Mondays are potentially a touch misleading, but so for example, if we take Friday last week, between the 9th and the 10th of April, that percentage increase there was 12%. Go back a week further again to between the 2nd and the 3rd, and that percentage increase there, 23%. Worth saying that the week before, we were looking at figures in the 30s. So, you know, that's not irrelevant, but we have to always continually stress these are still big numbers we're talking about. It's still horrible. The experts advise that we still may be some way off the peak. We've always known that it would take a good 2 or 3 weeks for any lockdown imposition measures to actually have an effect on that death data, but maybe a glimmer of hope.
Yeah, let's hope so. OK, Helen-Ann, thanks very much.